Now, I would like to invite Dr. Varun Mittal, sir, to please come up on the stage and share some words with us. Kidney transplant and Associate Chief, Uro-Oncology and Robotic Surgery, Artemis Hospital. I would like to invite Dr. Varun Mittal, sir, to please come up on the stage and share some kind words with us and give a light to this event.
Good morning, everyone. So, I am very thankful for the organization of Charitable Trust, Dr. Mangla, to invite me to share my views on organ donation. So, I will start my views. Like first, I will ask one question कि जो भी ऑडियंस में बैठे हैं, डायस पे बैठे हैं, ऑर्गन डोनेशन कितने लोगों ने ऑर्गन्स प्लेज कर रखा है? कैन यू रेज योर हैंड्स? One and two only. So I think there are like 40 people. So out of 40, I can see only two hands. So now you can see कि how important it is to raise the awareness. हम पब्लिक की बात कर रहे हैं, हम बात करते हैं कि एजुकेशन बढ़ाना है, अवेयरनेस करना है, बट आई थिंक हम सब लोग तो एजुकेटेड लग रहे हैं, तो बट उनमें से 40 में से सिर्फ 2 लोगों ने अंगदान किया है. सो दैट मीन्स कि इट इज़ सच ए सीरियस सिचुएशन कि now we should work on this. So this, so I will just tell you, मेरा presentation का वो तो slides कौन सा? Okay, here we go. So भगवत गीता ये बोलती है कि मृत्यु के बाद ये जो शरीर है, ये आत्मा जो है अमर हो जाती है, और जो शरीर है वो वहीं का वहीं रह जाता है. और वो उसमें ये लिखा है कि इसकी चिंता मत करिए, ये जो ऑर्गन्स हैं, आपका शरीर है, जब जो कुछ भी है, ये कुछ नहीं है, ये यहीं का यहीं रह जाएगा, आत्मा आगे जाएगी. मैं इसमें गलत हो सकता हूँ, बट इसको मैंने अपनी मम्मी से पूछा तो मेरी मम्मी जवाब नहीं दे पाई. तो मेरे को बट इसका ये समझ आया कि जब मैं ट्रांसप्लांट सर्जन बना, जब मैं ऑर्गन डोनेशन के साथ जुड़ा, कि ये मेरे को थोड़ा सा ठीक नहीं लग रहा कि जो शरीर है ये यूज़लेस नहीं है. जो अमर वर्ड है ना कि आप अमर हैं, उसका मतलब ये है कि आपको ही इसको अमर करना है. कोई गॉड नहीं है जो उसको अमर करेगा. मतलब आपको भगवान ने एक शक्ति दी है, आपका जो शरीर है वही एक शक्ति है. अगर ये आप ऑर्गन्स किसी को डोनेट करेंगे तो वो अमर हो जाएंगे. तो मेरे को ये अमर का शब्द का मतलब ये समझ आता है कि इट्स गिविंग अप द ओल्ड एंड यूजलेस वंस. ये मेरे को ठीक. डोंट गिव अप योर ओल्ड ऑर्गन्स, दे आर नॉट यूजलेस, दे आर एक्चुअली यूजफुल फॉर समबडी एल्स. सो ये जो ऑर्गन्स हैं किसी में जाएंगे तो ये अमर हो जाएंगे. मतलब आपका हार्ट जो है किसी और में बीट कर रहा है, तो हार्ट इज़ बीटिंग बट यू आर नॉट देयर, बट समबडी एल्स इज़ देयर. सो दैट मीन्स कि यू वी आर ट्रांसफरिंग द लाइफ. दैट मीन्स यू आर स्टिल लाइव आफ्टर योर डेथ. दैट इज़ लिविंग आफ्टर द डेथ. नेक्स्ट स्लाइड प्लीज. नेक्स्ट. सो वन लाइक जो हमारा शरीर है 8 लोगों की जान बचा सकता है. लाइक वी कैन सेव 8 पीपल्स लाइफ. लिवर, किडनीज, आईज, lungs, heart, pancreas, and many organs can be donated. Even skin can be donated, bones can be donated, and many things, and we can save many lives. Okay, next slide please. So what is organ donation? It is just the donation of your organs so that you can transfer your organs to anybody else who is in need, and he or she can live their own life. Next please. Next. So with this idea, the first successful transplant was done in 1954, and this was a living related transplant which was done by Dr. Joseph Murray and Dr. David Hume at Brigham Hospital, Boston. So kidney was transplanted from the identical twin, Mr. Ronald Herrick, into his identical twin, Mr. Richard. So like जो जुड़वा भाई थे उनमें आपस में मतलब एक को किडनी फेलियर था तो एक किडनी दूसरे में लगाया गया, तो वो दोनों आइडेंटिकल ट्विंस थे. सो दिस वाज द स्टोरी वेयर इट स्टार्टेड. नेक्स्ट स्लाइड प्लीज. सो देन फर्स्ट सक्सेसफुल हार्ट ट्रांसप्लांट, फर्स्ट सक्सेसफुल लंग ट्रांसप्लांट, देन और अदर ऑर्गन ट्रांसप्लांट वाज डन सब्सिक्वेंटली, and these are the pioneers who like started this journey and became the pioneer. Next please. Then comes to our India. Like India is not behind. We are like third in the world in organ transplantation. So even There are people we have done in our own different way, the heart transplantation, lung transplantation, kidney transplantation. All of us know Dr. P. Venugopal, Dr. P.K. Sen, who performed the like first ever kidney transplant, P.K. Sen by and Dr. Kanjrawal in KEM Hospital, Mumbai. And then first heart transplant was done by Dr. Venugopal in. Next, please. सो हु कैन डोनेट ऑर्गन, कौन डोनेट कर सकता है? सो हम दो लोगों की बात कर रहे हैं, एक तो लिविंग डोनेशन की बात कर रहे हैं और एक कैडावर डोनेशन की बात कर रहे हैं. लिविंग डोनेशन मतलब कि जो हम जीवित, जब हम जीवित है तब हम डोनेट, मतलब मान लें कि मैं मरीज हूँ और मेरे को ऑर्गन्स चाहिए, तो मैं अपनी फैमिली से बात करूँगा. सो लाइक माई नियर रिलेटिव्स, मदर, फादर, माई वाइफ, माई चिल्ड्रन, माई ब्रदर, माई सिस्टर. So anybody who is more than 18 years of age and less than 65 years of age can donate. Even we can, like somebody can donate after 65 years as well. There are some criteria that is called as extended criteria donor. Before that, health of that organ is obviously like it has to be taken care of, whether it is suitable to donate or not. Next slide. Living and deceased organ donation. Next, please. Maybe it is near relatives. There are laws behind this. So most of the donations which are living donations are happening with near relatives. But sometimes most of the near relatives are not fit enough to donate organs, and the transplant is utmost necessary. Then sometimes in the keeping in preview of the law, the unrelated donors are also like second degree relatives and third degree relatives also come into play. Thank you. Next slide. So these are the organs which somebody like now comes to the deceased donation. So whenever somebody dies, so अब मैं यहाँ पे ये बताऊँगा कि जो डेथ है वो दो प्रकार की है. हमें जो बताया गया था जब छोटे थे कि डेथ मतलब आप मर गए, बस ख़त्म हो गया सब कुछ. सो ऐसा नहीं है. सो देयर आर टू टाइप्स ऑफ डेथ, लाइक ब्रेन डेथ एंड कार्डियक डेथ. तो ब्रेन डेथ, brain and heart controls our body, and if brain is dead, if for some time like our heart, our lungs can work, within that time period we can retrieve those organs and we can transplant those organs into somebody who is in need of that. So like for example, जैसे मैम ने बताया कि रोड ट्रैफिक एक्सीडेंट है, तो हमारे देश में आज भी 1.25 2 लाख एक्सीडेंट्स रोज़ के रोज़ हम होते हैं जो डेटा बताता है. बट दे डोंट रीच अप टू द ट्रॉमा सेंटर्स. तो हमने अभी पुलिस के साथ एक सेमिनार किया. इवन पुलिस इज़ नॉट नोइंग कि व्हाट इज़ द कंसेप्ट ऑफ ऑर्गन डोनेशन. इवन द एम्बुलेंस पीपल डोंट नो व्हाट इज़ ऑर्गन डोनेशन. वो सिर्फ गाड़ी चलाता है, उसको ये नहीं पता कि जितनी उसकी लाइफ इम्पॉर्टेंट है उतनी ही उसकी डेथ भी इम्पॉर्टेंट है. अगर वो नहीं बच पाया बट ही कैन सेव अदर पर्सनस लाइफ. तो ये जो ट्रेनिंग है फ्रॉम रोड टू द हॉस्पिटल, इसमें बहुत सारे स्टेक होल्डर्स हैं, सिर्फ मेडिकल प्रोफेशनल नहीं है. उसमें एम्बुलेंस वाला बंदा है, पुलिस वाला बंदा है, लोकल पब्लिक है, गवर्नमेंट है, सोशल पर्सनस हैं, एंड देन हॉस्पिटल है. सो ये जो 40 मिनट्स का आपने जो बताया मैम कि इट्स वेरी इंपॉर्टेंट, सो ये अगर हम ये गैप फिल कर पाएँ तो उससे बहुत सारा अवेयरनेस होगा. तो हमने उनको ट्रेनिंग दिया पुलिस वालों को कि उस समय क्या करना है, कैसे उसको जल्दी से जल्दी लेके आना है. देन वी कैन, सो दैट at least we can save the life, or if you are not able to save the life, then organ donation can happen. Next please. So after natural death, that is cardiac death. So this now donations are happening even after cardiac death, but the time frame is very limited. We have to retrieve the organs within 60 minutes and we have to transplant them. But in brain death, it gives some time, at least 72 hours we have, so that we can retrieve the organ. Next please. So brain death क्या चीज़ है? What is brain death? Brain death means कि there is a connection of the brain with the body via the neck and spinal cord. So this is called as brain stem. So brain stem controls all the functions. So when there is injury to the head, so there are brain stem functions are not there. So the control of the brain with the body is not there. So we have to artificially support that body to keep the organs alive. Like we have to give ventilatory support so that oxygen can be delivered to the organs, so that heart continues to beat, lungs continue to exchange, and other organs continues to work. So within that time frame, till that time we are supporting that body with that life support system, we can retrieve the organs. So that is called as brain death donation. Next please. There are many causes of brain death, but mostly these donations happen after the road traffic accident or some like brain tumor patient who undergo surgery and they are not able to survive, or there can be a stroke, there can be heart attack with leading to loss of blood supply to the brain, and then other many causes which directly lead to the brain death. Next. So these are the causes like brainstem reflexes, spontaneous respirations are gone, causes like trauma, stroke, hypoxic injury, and brain tumors. Next, please. So what is this steps of brain death donation? Like first of all, the patient comes. If the patient is not conscious, that doesn't mean that the patient is brain dead. There can be some poisoning. There can be just low blood sugar. There can be just like hypotension, low blood pressure. So like the team has to see what is happening. So when that cause is established, like the brain is not working, then only you can proceed for brain death. ऐसा नहीं है कि कोई भी अनकॉन्शियस पेशेंट आया तो जो कोमा और ब्रेन डेथ में फ़र्क है. कोमा मतलब उसकी ब्लड सप्लाई ब्रेन की मेंटेन्ड है, ब्रेन के ब्रेन स्टेम रिफ्लेक्सेस मेंटेन्ड है, बट पेशेंट अनकॉन्शियस है. ब्रेन स्टेम डेथ मीन्स कि ब्लड सप्लाई कॉम्प्रोमाइज्ड है एंड ब्रेन स्टेम रिफ्लेक्सेस भी नहीं है, देन यू कॉल ब्रेन डेथ. यू कैन नॉट retrieve organs from a comatose patient who has intact brainstem reflexes. The brainstem reflexes has to be tested, then brain death has to be declared. Next, please. So these are the few tests to confirm the patient is brain dead or not. Like there are pupillary reflexes, corneal reflexes, doll's eye movement, cough reflex, gag reflex, and then the ventilator is like the patient is out of ventilator for 10 minutes, even then there is no respiratory effort. So these are the few tests which are under the law and which are mandatory to do those, and then document that these tests are positive and there is no brainstem reflex, then only you have to declare that patient is brain dead. Next, please. So similarly, eye donation, like ma'am has already told you, like keep there are few precautions. If somebody wants to donate eye, the body has to be kept, eyes has to be kept moist, there should be no fan near the body, and it has to be done within the 6 hours of death, and nearest eye bank has to be contacted so that they can come at home and then retrieve the cornea. Next, please. So I have already explained the process. Next. So whenever there is a brain death, consent is there, and the hospital, the doctor, the treating team informs the family, the consent is taken, and then if the family gives consent, and then the nodal agency, like the regional organ transplants organization ROTO, and then state transplant organization STOTO, and then national organ transplant NOTO. So all this is like hierarchy, and they have to be informed, and there is a waiting list. Like every transplant patient is on the waiting list, and so then they decide that these organs has to be allocated to which hospital. So this is alphabetical order, and there is a point system. So whenever then they send the messages like the hospital which is on the waiting list, then to retrieve the organs. So like for example, if the kidneys, then there are 2 kidneys, then 1 kidney will go to the government hospital. If the government hospital is not ready to accept, then that kidney goes to the private hospital, and 1 kidney remains in the hospital where the brainstem declaration has been happening. Next, please. So the law, I have already told, the Human Organ Transplantation Act, which is everything is under this law. Next. So the lifespan, like heart, you have to retrieve within 6 hours, kidneys up to 36 hours. Like sometimes like the call comes late in the night, like about 12 hours, then we don't say no directly. We have to assess first whether how was the patient, what is the cause of the death, what is the vitals of the patient, how is the blood pressure going on. Then we decide, then we can have the estimate how the organs are functioning. Then we can have the reports of all the tests, and then decide whether kidney, heart, or liver. You cannot take organs and you can do a transplant. You have to see whether this heart is appropriate for the patient or not, whether this kidney is appropriate for that patient or not. Like for example, there is a 80-year-old male who is already, the kidneys are not good functioning, and how can I take that kidney for a transplant? Then I have full right to say, we are not going to take this kidney. Okay. So then liver, pancreas, all these organs can be retrieved. Next. So now coming to the numbers. So in मतलब हमारे देश में हम आज प्लेज की तो बात कर रहे हैं, बट बहुत लोग प्लेज कर रहे हैं, बहुत सारे ऐसे अवेयरनेस इवेंट्स हो रहे हैं, बहुत लोग ऐसे प्लेज करते हैं. बट इवन आफ्टर प्लेजिंग, जिस दिन ऑर्गन डोनेशन की बात आती है, डोनेशंस आर नॉट हैपनिंग. हमारा कंट्री, अगर मैं किडनी की बात करूं, सिर्फ 15 से 20 हज़ार ट्रांसप्लांट कर पा रहा है, जबकि वेटिंग लिस्ट 3 लाख से ऊपर है. हमारा कंट्री वर्ल्ड में 3rd नंबर पे है, यूएस और स्पेन के बाद. सिर्फ 20,000 नंबर्स के साथ भी हम 3rd नंबर पे हैं. बट फिर भी मतलब इतना बड़ा गैप होने के बावजूद भी, इवन आफ्टर प्लेज दीज अवेयरनेस कैंपेन्स आर हैपनिंग, बट स्टिल पीपल आर नॉट गिविंग. लास्ट ईयर हमने आर्टेमिस में 32 ब्रेन डेथ डिक्लेरेशन किया, बट ओनली एक फैमिली मानी. अभी लॉ ने, अगर कोई पेशेंट सर्वाइव नहीं कर रहा है, पहले ये होता था कि फैमिली से पूछ के वेंटिलेटर हटाया जाता था, बट ऐसा लॉ चेंज हो गया अभी. नाउ यू कैन विड्रॉ द लाइफ सपोर्ट as soon as the brain death declaration is final. Then you have to ask the family whether they are ready or not. Then if they are ready, then the organ donation process starts. Otherwise, you have to withdraw the life support. You are not supposed to keep that patient unnecessary on that bed. So this is the number, like more than 5 lakh patients are waiting for different kind of organs, and then but only 20,000 lung transplants are happening, only 1,75,000 people are waiting for kidneys. 50,000 patients are dying from heart disease, and 1 lakh patients are dying from the liver disease. But the transplants are not happening. Next, please. So these are the ways we can raise awareness. Next slide. So this is the comparison. You can see India lies nowhere. So there is no, the bar has not started. And you can say the Spain. इन स्पेन ने, गवर्नमेंट ने क्या किया कि जो भी ब्रेन डेथ बॉडी है वो गवर्नमेंट प्रॉपर्टी है, वो फैमिली का प्रॉपर्टी है ही नहीं है. मतलब गवर्नमेंट वुड डिसाइड कि इसका क्या करना है. सो इसलिए वॉलंटरी डोनेशन या इनवॉलंटरी डोनेशन कुछ है ही नहीं है. सो एवरी डेथ इज़ विद द कंट्री, सो एवरी डोनेशन हैज़ टू हैपन. ओके, सो दैट्स वाई स्पेन इज़ ऑन नंबर 1. देन नेक्स्ट इज़ यूएस, ब्रिटेन, Canada, Australia, but India lies nowhere. India is just 0.80 per million population. Next, please. So there are many organizations. One of is Organ India and the Mohan Foundation, and many other charitable trusts are there, where you can go to their website. You can check how to pledge your organs. Then you can just fill in your details with name, phone number, and Aadhaar number, and then you can pledge your organ. They will ask you, what do you want to donate? Full body, or specific organ, or only tissue. Tissue means bone and skin. Organ means liver, kidney, pancreas, heart, then eye donation. Whatever you want, you can pledge. Then they will send you a donor card. Then you can keep in your pocket, and then you have to inform your family कि मैंने अपने organs दे दिए हैं, भाई मेरे को कुछ होता है तो आप मेरा सारा body उनको दे देना. नहीं समझे? So this is the process. This is called as organ pledge, voluntary organ pledge. Next, please. Or directly, like you are sitting in, you can scan your this QR scanner. Then you have to fill just 3 things: name, phone number, and Aadhaar number. Then they will ask the options, and then you can pledge, and then you can have the card, and then you can inform the family. So this is organ pledge QR code. Next, please. Mythbuster. The people ask कि हम अगर डोनेट करेंगे क्या मेरी बॉडी को काट दिया जाएगा, हमारे रिश्तेदार की बॉडी को? क्या हम शमशान घाट में ले जा पाएंगे कि नहीं पाएंगे? क्या हम अपने रिचुअल्स या राइट्स पूरे कर सकते हैं कि नहीं कर सकते हैं? सो द अटमोस्ट रिस्पेक्ट इज़ गिवन टू दैट बॉडी, एंड आफ्टर रिट्रीवल ऑफ द ऑर्गन द बॉडी इज़ अगेन, द सर्जिकल एनाटमी इज़ recreated, and proper dressing is done, proper packing is done, and with all due respect, the body is handed over to the family, and then family can complete all the rites. Second, whether I have to pay more money for this operation? No. So as soon as the family gives consent for organ donation, the billing cycle stops. Whatever the bill is there after that, the family is not supposed to bear that bill. Next, after that, the hospital bears all expenses of artificially supporting the donor. No, if there is a consent, then the hospital will bear. If there is no consent, then the life support will be withdrawn. As simple as that. And organs are retrieved surgically, and there is no disfigurement occurs. Next, please. Next. Next. So these are the few awareness sessions which we have done, like they are Nukkad Nataks, the event with the police in a form of skit, and then pledge. Next, please. These are the recent two patients who underwent lung transplant. So one is international patient, one is Indian patient. This is the COVID warrior. The patient was on oxygen for last 5 years. He was not able to work and he was not able to survive without oxygen. Now he is perfectly all right. So this is the power of organ donation. Next, please. This is a 25-year-old boy who underwent a road traffic accident and he donated all the organs. Thanks to the family who came forward, who became so courageous. अभी recently एक patient आई है US से, Indian citizen थी, and she was pregnant. उसने बोला कि मैं अपनी मम्मी के साथ जाके अपनी डिलीवरी प्लान करूँगी. तो उसने US में डिलीवरी नहीं कराई. तो यहाँ पे आई, जब आई तो उसको रूटीन चेकअप में उसको हाई ब्लड प्रेशर मिला. एंड जब वो OPD में आई तब वो चक्कर खा के गिर गई. एंड शी हैड हेड इंजरी एंड देयर वाज ब्लीडिंग इन द ब्रेन and she became brain dead. But see the courage of the family. The family came forward and they were ready to donate organs. And the patient could not survive, but heart, lung, kidney and pancreas all were donated. And baby is still alive. So that is the power of organ donation. I think so these are the things which motivate us. We should also come forward and pledge our organs at least. Next, please. So अंग दाता बने या जीवन रक्षक बने. Thank you. So I would love to have some questions on organ donation. Okay, thank you.
Thank you so much for the beautiful address. Great presentation and so much of learning. तो क्या हम तैयार हैं किसी प्लेज के लिए जो अंगदान का जो ये आज जागरूकता कार्यक्रम होप चैरिटेबल ट्रस्ट कर रहा है, क्या हम तैयार हैं? Are we ready to take that pledge? I know it's very, very difficult. But then, vasansi jirnani yatha vihai tatha sharirani vihai. So even after our death, our body, our mind, our heart will remain in somebody else's body. I think जब तक प्रोग्राम ख़त्म होगा तब तक शायद हम प्लेज लेने के लिए तैयार हो जाएंगे, और ऐसा होना भी चाहिए, बिकॉज नो एक्ट ऑफ जेनरोसिटी इज़ मोर दैन गिविंग समबडी वन ब्यूटिफुल सनराइज इन लाइफ. थैंक यू.
देश विदेश की ताज़ा तरीन खबरों से अपडेट रहने के लिए आप हमारे चैनल को ज़रूर सब्सक्राइब करें और साथ ही बेल आइकन को भी ज़रूर दबाएं ताकि सभी खबरों से आप और आपके जानने वाले रह सके अपडेट.